So cross-sectional imaging, we don't prefer to diagnose Pats disease on cross-sectional imaging because the plain radiograph is excellent. However, I'm not sure here in Taiwan, but in America, many patients come to us first through CT or MRI because the primary physician orders CT or MRI. They just skip the X-ray, they skip everything and go straight through to the MRI. So because of that, we need to be aware of what it looks like on CT and MRI. Otherwise, we can get very confused. Now, CT is easy. It's kind of follows what the X-ray will look like. You would have loss of bony trabeculate early on in the lytic phase. Later on, we have cortical and trabecular thickening. So in the skull, this is an axial image through the skull, through the head and bone window. You can see, very interestingly, pretty normal left side. On the right, there is a diffuse lytic process, very extensive, involving the entire right side of the skull, and a very sharp line. Look, notice that sharp line between the abnormal bone and the normal bone. I mean, how many processes do you know of that will do that? Really nothing. This is Pats disease. Notice it's just like a straight line. And in addition, notice that the inner table is more involved than the outer table. Inner table more involved than outer table. That's the other feature we see in Pats disease. In fibrous dysplasia, that relationship is reversed. In fibrous dysplasia, the outer table is more involved than the inner table. The same patient, the slide is shifted to the right wing, but in this same patient, 8 years later, where we have that large lytic lesion in the right side of the skull, now you can see the cotton wool appearance, the repaired bone, and the expansion of the diploid space. So this is the cotton wool appearance on CT scan. And earlier we saw a case of praxis in the proximal humerus, the subtle trabecular thickening. This is the same patient. You can see that trabecular thickening over on the right side comparing to the left. Subtle. There's Pats disease right here. And in the vertebra, same thing. We have a trabecular thickening. It might, at first glance, mimic a hemangioma, but it's different from hemangioma, right? Down lower down, notice this expansion of the spinous process. Even though it is expanded, the cortex is not lost. It's not destroyed. Okay? Expansion of the bone, but yet the cortex is not destroyed. Pretty unusual. This is Pats disease. On the coronal reconstruction, you can see that earlier, the trabecular pattern, a little bit more prominent. The vertebral body is a little bit bigger. Here in the pelvis and axial through the iliac bone, you can see that on the left side, the cortex is thicker than the right side. A little bit more wavy, but it's not destroyed. And there surely are some little islands of sclerotic bone being formed.